Alright, hi everyone. Welcome to another virtual shadowing session. Today we have our amazing guest, Dr. Kodak, and she will be sharing her journey to dentistry and some interesting cases. So, Dr. Kodak, whenever you're ready, you could go ahead and start.
Hi, everyone. My first name is Nidhi, and I'm happy to be talking about my dental journey over here. I didn't follow a very conventional path. I'm not sure which route you guys will be going, but I'll talk to you about the things I did in my dental career so far. And then if you have any questions at the end, just let me know, and I'm happy to answer them. So I graduated as a general dentist in 2011. So, wow, that's been 10 years, I just realized. And I am currently a pediatric dental resident in Philadelphia at Temple University Hospital. So, let me talk to you about my journey. I grew up in India, and then I went to high school in Dubai, and then I went to dental school in India, then dental school again in the United States, in Chicago, Dubai, Kenya, and now Philadelphia. So I've kind of been all over the globe. It's been a little weird, but it's been really fun. So my initial bachelor degree in India, how it works is when you're 18 years old and you've just finished high school, you go to dental school directly. So that was a Bachelor of Dental Surgery, which I got from a university called Manipal University, and that was in 2011. And then any foreign dental graduate who comes to the United States needs to go through a 2 or 3 year training program to convert their dental degree into an American DDS, and that's what I did next. So 2014, I graduated from University of Colorado, where I got my Doctor of Dental Surgery, which is your DDS. Whether it's a DDS or DMD, it doesn't matter. It's the same thing. Sorry. And I am currently a resident at Temple University Hospital. These are my co-residents, my current family, and I've been here for a little over a year now. And I'm currently the chief resident at our program. So my work experience, I have so far worked for 6 years after graduating from dental school in Colorado. So, or I guess residency counts as 7 years, and then I practiced in 4 countries. And I'm going to talk to you about each experience, each country, and how it kind of differed one from the other. So, I love this question, which is, does dentistry change across borders, or does it remain the same? The answer is a little bit of both yes and no, and I'm going to tell you why that's the case. So this is not a case. This is one of the dentists that I follow, but this is a case of veneers, which is why it, is very representative of what Dubai or United Arab Emirates stands for, which is aesthetic dentistry. People are very aesthetically oriented, and I noticed that it was a lot of cosmetic aesthetic. I mean, that was Hollywood smile is what people called it there. So this is a case of a veneers where on the left you'll see, to me it looks like a perfectly beautiful smile, but the patient wanted to make it, the perfect Hollywood smile, so they got veneers done. And that's the treatment that you see on the right, which is literally an eggshell thin layer of porcelain which covers the tooth. Sometimes you want to shave off, 0.5 to 1 millimeter off the tooth in order to put something on it. It's almost like a laminate. So that's what a veneer is. And apart from that, there was a lot of emergency based treatment. So what happened in Dubai is people didn't come in for regular dental checkups and regular dental treatments as much as they do in the United States. It was either people coming in for really extensive aesthetic work or people coming in when they were in pain, which is why there was a lot of educating my patients. A lot of the times when they came in for a regular exam and I wanted to take x-rays, the next question would be like, but I'm not in pain, why do you need x-rays? which is why it was a lot of talking about, hey, x-rays actually help us find cavities when they're small or when they're just starting, rather than when you come out with a big bombed out tooth, which I can no longer save, or it already at that point needs a root canal and a crown. So there's a lot of talking to patients, to families, to parents about their kids. And then I went to a lot of schools and I did oral health awareness campaigns with children, with parents. So that's what my experience in Dubai was a lot like. And then dental tourism exists in Dubai, which is interesting. I'd never heard of it before. So most people in Dubai don't have dental insurance, and it can be quite expensive to get work done. So a lot of people actually travel to their home countries. So they'll go to India, they'll go to Sri Lanka, they'll go to Egypt, get all of their dental work done, and then come back to Dubai. So that's kind of like tourism, but for dentistry. So that was Dubai. And I'm going to move on to all right, so this picture is just a regular, somebody came in with a chipped tooth and we did a white filling. This is called a composite filling. And, it's a very short appointment to fix it. White fillings like this can chip off easily too. And I always tell my patients that, hey, if you can chip through an actual tooth, which is actually quite strong, you can definitely chip through a filling. But little minor changes that you make like this can really dramatically improve somebody's smile. Another thing that was very popular was whitening. With whitening, there's two different main subcategories. One is home whitening and one is in-office whitening. So in office whitening, we use LED lights to activate a whitening gel, which is actually quite strong, and if not applied correctly, it can burn the gum. So it's only meant to be applied on the teeth, and this gives you instant results. The patient leaves at the end of a 45 to 1 hour appointment with whiter teeth. As opposed to home whitening, where we give the patient trays with whitening gel, which they can apply at night and go to bed with it. And these are much lower concentration. They also have wonderful results, but obviously it requires a lot more compliance from the patient or cooperation to actually wear that. With any kind of whitening, there's always sensitivity. Well, not always. Majority of the times, I would say there is some sort of sensitivity involved. So I always, pre-warn my patients. And a lot of people will try the Crest white strips, and I think that's a great way to start to see how your teeth are going to respond to it. With any Crest white strips, they're not custom made to your teeth. They're just strips that fit. So they're not going to fit the shapes of your teeth. So again, it can cause some sensitivity. It can cause a little, mucosal burns in the mouth. So you want to be careful with it. Then I decided that I wanted to almost reconnect with dentistry because I felt like it was a lot of aesthetic. And I felt like I almost lost my love of dentistry or questioned why I got into it in the first place, which was to help people. So I decided to go and volunteer in Kenya at the Masai Dental Clinic, which was in Masai Mara, Kenya, literally in the middle of nowhere, and it was phenomenal. So this is a clinic which is in the middle of the Masai, reserve. So we are surrounded by animals everywhere. There is a Maasai population of about 40 to 50,000 people that this clinic caters to. And all my patients were the Maasai tribal people. And this clinic, if you see on the picture on the left, there was an electric fence around the clinic which protected us from the animals. And that's an elephant right outside my clinic at night, which was pretty cool. Fun fact, in Kenya, it's not the, of course we're afraid of the lion, but one of the most feared animals is the elephant because they're not the zoo elephants or, circus elephants. They will attack humans and crush you. So that's one of the most, most common species to be afraid of. And then it was really cool in the morning by sunrise. I saw this giraffe, and then I was treating one of my patients, and I'll just play this quick video. Just waiting for the anesthesia to kick in. And it's casual, Bambi, chilling outside. So it was cool because there was like deer and baboons all outside my clinic windows all the time. Sometimes there was monkeys, they try to get in, so you had to keep them locked. But the Maasai tribal people always know how to respond to animals. We were never allowed to leave the clinic fence without a local Maasai person, because they smell the air and they say, "Oh, that's an elephant," and I'm like, "Where?" So it was kind of cool just to see how they live in that part of the world.
Just waiting for the.
This was the clinic, and I'm going to play a video. It was a pretty sophisticated clinic. It's considering that there's no buildings around, we're literally in the middle of the African savannah. This clinic was actually funded by Loma Linda University in California, and they used to send a lot of their students here, so it's pretty cool. And it's 3 dental chairs. We have dental assistants, sophisticated instruments, and we provided anything to get the patients out of pain. So there was a lot of extraction-based dentistry. We did fillings, we did root canals. We didn't have a lab, so it was hard. We weren't able to make crowns and things like that. But it was a pretty amazing thing to be able to serve the Maasai community. So this was something interesting to me. If you notice this woman on the left, she has a massive gap between her 2 front teeth, and this is called a midline diastema. Now, this is very common in the Maasai culture. With evolution, our jaws are changing, and now a lot of the young kids that I was seeing had smaller jaws, which means they didn't have spacing between their teeth. And a lot of the times, the parents came in and said, "Hey, he has extra teeth. Can you remove them?" And they actually wanted me to extract some of their permanent teeth. And at that point, I had to educate them and say, no, this is the regular teeth that they used, to chew and bite and speak. But for them, it's like, doesn't he have gaps between his teeth? Remove it. So it was a lot of educating the parents, which was sometimes, difficult, because a lot of the times, if you as the provider didn't take care of it, the parents would actually extract the teeth at home without anesthesia, is what I was told. So you have to pick your battles, but it made me realize that culture plays an important role in dentistry as well. And this picture on the right was special because this was the village head, and it was an honor to have him on my dental chair. So that was pretty cool. Then I actually went to dental school in India, and I volunteered in the northern part of India, which is on the border with China, called Ladakh. And it was a group of 40 dentists and dental students that we went, and it was pretty insane because we got to meet the Dalai Lama. We worked at primary healthcare centers. We worked in a dental van and provided services to children in that part of northern India, and it was a really rewarding experience for me. This was back in 2011, kind of between my dental school in India and starting dental school in Colorado. And coming to dentistry in the United States, it's a lot more sophisticated care. So what I notice is the emphasis is a lot on preventative dentistry. We want to start seeing kids at the age of 1. We want to start, putting fluoride vitamins on their teeth. We want to prevent them from having cavities so we can prevent them from having extensive dental work done. So you want patients to come in every 6 months and have their checkups, have their cleanings, come in annually, or, once in 2 years we'll take x-rays on them and things like that, so we can catch everything early. A lot of the times dentistry here is, unfortunately, insurance plays a very big role on treatment. So as a dentist, your treatment plan shouldn't change. You are going to provide or suggest what is, in your opinion, the best treatment plan for the patient. Then based on what's covered by their insurance, they may or may not opt to do your recommended treatment, in which case you have to give them certain other options that, of course, are always in the best interest of the patient. So the pictures on the right, on top, it's just a regular cleaning appointment. When, there's a lot of staining on the teeth, there's calculus and tartar buildup, you want to get your regular cleanings done with the dentist or a hygienist every 6 months. A lot of the times, if you have a lot of extensive bone loss around your teeth, we might even recommend it every 3 to 4 months. The picture in the middle is an implant-supported denture. This patient had lost all of their teeth. They had implants placed on the upper jaw and lower jaw, and then these are dentures that almost clip onto those implants. And then at the bottom, this patient had a few cavities that were fixed. They were removed and filled with white filling materials. This was a completely broken down tooth, so that was extracted. And this was a tooth with a big cavity, so it looks like we've done a root canal possibly and a crown, or maybe that's a filling. All right, so moving on to the next picture. This is just, I like to call these party teeth. I had a patient who came in and had been missing the front four teeth for a couple of years. And this poor woman hadn't smiled in literally a decade because she was so embarrassed. Imagine smiling and you have no teeth in the front. So, as an immediate measure, what we did is we created this, which is a flipper or an interim partial denture. It almost like clips onto the rest of your teeth, and it helps you buy some time until we're able to create a more permanent solution. Like, can this woman have implants? Let's take some X-rays, some CBCT scans, and see, can we replace these teeth permanently rather than something that's removable, which in this case it was. Now, in the United States, once you become a general dentist, so that's your 4 years of undergrad, or I believe sometimes 3 years, and then 3 or 4 years of dental school, you are a general dentist. So you will be a DDS or a DMD, and then a lot of people will choose to specialize, which is what I'm doing right now. I did practice for a few years prior to specializing, but if you do decide to specialize, there's quite a few branches. I'm not going to go into details of all of them, but I'll talk about a few of them. So endodontics is the art of root canal treatment. So you would be an endodontist, and a lot of the times general dentists will do root canals, but if a tooth is complicated, the anatomy of the tooth is complicated, and you don't think that it is within your scope to treat the patient to the best of your ability, that's when you want to refer your patient out to a specialist who spent 3 extra years training to become a specialist. And they use pretty sophisticated, equipment. Nowadays, root canals are done with microscopes as well. There is orthodontics, which is, dentistry. There's conventional braces with metal brackets. There's ceramic brackets that were more aesthetic, and now we have Invisalign as well. I am Invisalign certified. You don't have to be a general dentist. You don't have to be an orthodontist to do Invisalign. You can do it as a general dentist, but usually you pick on the easier cases where there is minimal tooth movement, and then you can move on up the ladder. So this is a picture of Invisalign trays for this patient. And then this is my forte, which is pediatric dentistry. It's an age-defined specialty which provides primary, comprehensive, and preventative therapeutic oral health for infants and children through adolescents, including those with special healthcare needs. So usually we start seeing patients at the age of pretty much their first birthday, unless it's something, a child has a fall before that and comes in, but usually we recommend them to come in by their first birthday. And then we usually see them till the age of 17 or so, and anyone with special healthcare needs, you can see we see them beyond that age as well. So this is what we call a knee-to-knee exam, and this is us establishing a dental home. Look like I'm torturing this poor child, but he was about 1 year old, and mom was really struggling, saying, I don't know how to brush his teeth, I don't know how to keep his mouth open, and he had just started getting in about his 4 front teeth and 4 bottom teeth. So this is how we demonstrate to the mom, this is how you brush, this is how you make sure you don't miss the spots, lift his lip. And you want to establish a dental home. So, there is a place where this child comes in every 6 months, and, they don't develop this insane fear of the dentist, but almost realize that it's just part of their annual checkups or whatever it is. And we create such a fun environment that when they start getting older, they're not, they don't have a deathly fear of the dentist, but actually look forward to their appointments. So at the first dental visit, what are we doing? Sometimes I have parents ask me saying, but he's 1, what are you going to, do at this appointment? So we talk about a lot of things. We, first of all, brush their teeth. We check for cavities. We apply fluoride vitamins on their teeth. And then we talk about things like, okay, is your child using a thumb all the time? Or is your child using a pacifier all the time? Why are these important? Because it's okay to, suck your thumb or finger or on a pacifier until the age of 1 or even 2, 2.5. Beyond that, it can actually be detrimental to the shape of your bone. So it can change the direction of your teeth coming in, and it can also change the shape of your upper jaw. And this is a fun fact, but the only bone in the body that a child can actually change the shape of is their upper jaw or their maxilla. We talk a lot about diet, saying, what are the foods that they should be eating or what are the foods they should be avoiding. So, for example, the area that I practice in, we have parents coming in with children who are 3 years old with 20 teeth in their mouth and with 20 cavities, so a cavity on every single tooth. And it's really disheartening to see that. And a lot of the time, it's just about educating these parents before it gets to that stage, because you don't want to introduce sugar into their diet that early. These kids are having juice all day long. So for someone about less than 3 years old, all they really should be having is a 4-ounce cup of juice, which is the max they should be having in a day. We don't even want them to have it every day. We want to stay away from chocolate milk, strawberry milk, regular white milk is okay. Water is great, but all these kids have so much easy access to sugar that they're developing cavities very quickly. A lot of them are going to bed with a bottle of milk, which again, the name of the cavity is baby bottle tooth decay. And parents just don't know. They think it's normal to put their child to bed with a bottle of milk. In fact, I'm pretty sure that happened to me growing up as well, just because our parents didn't know any better. So it's a lot about educating parents about how to prevent cavities in their children. It's a lot of behavior management, because not every child comes in happy, and sometimes they love their dental appointments and sometimes they're just terrified. They've probably either had a previous dental visit which was pretty scarring, or they've just had their shots and vaccines done recently, and coming to any kind of healthcare facility terrifies them. So it's a lot of talking to them, making it fun, helping them trust us, so that we can actually get to the point where they'll open up for us, and it's not always a screaming battle at the dental clinic. And sometimes you got to do what you got to do. If the child has an infection in his mouth, a massive abscess, sometimes we really have to get in there, whether they're fighting you or not, just to take a look so we can actually get them out of pain and get the infection taken care of. So by behavior management, it's about the way you talk to kids as well. So, for example, if I'm getting a child numb for a filling, I'm never going to show them the needle. I'm never going to say that word. So initially we put the topical anesthetic, which is a gel. So, I'll say, ooh, I have some strawberry bubblegum jelly for you. And then I'll put it on their gums. I usually give them laughing gas, and I'll say, oh, I have some really cool happy air. Would you like strawberry, banana, bubblegum? Start distracting them. Give them the nitrous oxide so it kind of takes the edge off. Once you put the topical, you actually want to inject them with the local anesthetic. So, if it's a lot of the times I'll say, ooh, did you watch Frozen? Because you know how Elsa has a frozen water? I have some really cold water that I need to put on your tooth. So I want you to take a really big smell for me. When I say that, they're taking a big smell of the nitrous oxide. And then a lot of the times they don't even feel the poke of the needle, because I'm just constantly talking. I talk all day just to distract the kids, and that often does the job. And suddenly I'm done with the anesthetic, and they say, ooh, that's weird. My mouth feels like it's going to sleep. And I'll say, well, that's perfect, because, now I can catch the sugar bugs. So, I never lie to a child, but it's all about distraction. I feel like if you lie to the child, you lose their trust very quickly, but it's about how you say the words. If I'm using a drill, I'll say, oh, this is my electric toothbrush. And if I'm putting fillings, I'm like, oh, I have a white paint that I need to put on your tooth, and it's going to make your tooth really strong. And if I'm putting a silver cap, I'll say, oh, I'm going to put a princess crown on your tooth. So again, it's all about the words you use, which will help you behavior manage your child. And at the end of the day, you're doing some pretty life-changing dentistry for these children. This is a pretty amazing case. So this child was, I think, less than 3 years old when they came in, and they had cavities in all of their front teeth. So first we applied something called silver diamine fluoride. It's a treatment that helps to stop the cavities. Unfortunately, a downside is that it makes the cavity a pretty dark black color. So that's what you're seeing on the left side. And eventually, when the child was a little older and we could take him to the operating room to get the treatment done, we put white caps and white fillings on these teeth. And, it looks so natural that you could never tell that this child actually had dental work done. And imagine the confidence boost you're giving this child and the parents. I literally have parents coming in saying, that, oh, like he has his school photos coming up, but he doesn't want to smile because his teeth are all black in the front and things like that. So, you can have a pretty amazing impact on a child's life, on a child's confidence and self-esteem. When a child does well for you in the clinic, you always want to do a positive reinforcement. So, if they behave really well, I'll reward them with a prize or a sticker so that they know that, okay, good behavior is good. I get a prize. And if they're, terrible and they're screaming bloody murder the entire time, I'm not going to give them a prize at the end, because they need to know that, there's nothing that I did today that hurt them, but they were just so afraid, and that's not going to work every time. So, there's always positive reinforcement when there's a response or a behavior that is in their best interest. So what are the common complaints that usually parents bring their children with is, oh, he's in pain, there's a chipped tooth, one of his teeth fell out, he has shark teeth growing in, because a lot of times they have their permanent teeth growing behind the baby teeth and it looks like there's 2 rows of teeth. Or a child has an infection and comes in with a swelling. Sometimes parents come in and say, oh, their teeth are have a lot of spaces between them, or there's just no space and the teeth are coming in all directions, there's a lot of crowding. So what are the procedures as a pediatric dentist that you will routinely perform? You do a checkup, cleanings, fillings, silver crowns, white crowns. We're doing baby root canals, so that's a nerve treatment. Sometimes we're extracting teeth. We're doing space maintainers. We're making habit-breaking appliances. What that is a lot of the times it's an older child who's 10 years old and they're still sucking their thumb. So we make certain appliances that help to break the habit, which almost serve as a reminder. It'll be like a little wire at the back of your teeth. So the moment they put their thumb in, it's going to be like a reminder saying, oh, okay, no, I need to break this habit. So those are some of the procedures that we perform. Now moving on to some of the cases, I think I have maybe 2 interesting cases for you. So this is an incisor exposure in a 9-year-old child. So incisor is your front tooth. It often comes in around the age of 7 or 8. This child was 9 years old and he had delayed eruption, so there was no front teeth. It was almost like they were kind of just at the gum line but not able to come through. And sometimes we see that there's thick fibrous tissue over the teeth and the teeth are just not able to pierce them and come in. So we will do a little laser exposure and it almost accelerates the coming in of the tooth. So this is what it looked like before. This is actually a habit-breaking appliance. So that wire you see, it sits behind, on the upper jaw, and the moment that child's going to put their finger in, they're going to feel that. Now here is the outline of the 2 teeth that were just not coming in. So what did we do? I'm going to play the video where we use a laser and almost unveil the tooth underneath. So let me play that for you. I love you, baby, and if it's quite alright, why you too, baby? So on these lonely nights, I love you, baby. Just to me, and I say, I love you, baby, and if it's quite alright, why you too, baby? So on these lonely nights, I love you, baby. Okay. So that was the procedure that we did. This was at the end of the procedure. We found the 2 teeth. They were lying right underneath. We had taken x-rays before to confirm that they were there. This was about a month later. Those teeth really started coming in. And, it's a big difference that you make to a child's life when they have no teeth and then suddenly there are teeth a month later. This poor kid had severely broken down front 4 teeth. So we actually had to extract them. And he was 3 years old. So he was 3 years old. The front 4 teeth were removed because he had been going to bed with a bottle of juice. They were so decayed and infected. And this is an area that you're seeing that was healing that had already taken place, but he's missing those 4 front teeth. So we made this little appliance that helped to replace those teeth. It had bands at the back that went and fit on the teeth at the back to give us some extra support. And that's a before and after picture. So what a great improvement in his smile that is. And, when you see a happy child, there's nothing else that can really match up to that feeling. It's another case. So we had a 6-year-old kid, and this is a silver cap. That's what it looks like. And then this is a massive cavity that he had on this tooth, and it was literally, the tooth was breaking down. So first we removed all of the cavity, and we put a little band around the tooth to give it some support, and then we did a white filling. This tooth is likely going to need a crown in the future to reinforce that tooth. But this is, again, us buying time to see how this child responds to a deep filling. So this is how we would take care of a really big cavity in a child. That is my Instagram and my email. So if you guys have any questions, feel free to reach out to me. And right now, I'll let Eva and Navira let you guys ask questions if you have any. So let me know.
All right, thank you so much for that amazing presentation, Dr. Kodak. We will now be going into the questions portion of this session. So the first question, in regards of the cases that you were just speaking about earlier, for that tool that you used, to the breaking habit tool, how does it really, if it does affect like sort of their speech, and is it like removable at all, like at night to like so it won't bother them, or how does it really affect their quality of life?
Okay, so that is kind of a last resort tool. If a child comes in at the age of 2 or 3 and they're sucking their thumb all the time, we use very basic things to break the habit first. We'll give them this special nail polish that's really bitter. So the moment they put their thumb in, they're going to be like, oh, that tastes gross, and they stop the habit. Sometimes we tell the parent, let them sleep with a sock on their hand. So again, if they try to suck their thumb, they're not going to get access to it. Or sometimes let's say put a bandage around their elbow so they can't even bend their hand so that the thumb can't reach the mouth. Now, in a child that's much older who has just not been able to break their habit their entire first 10 years of their life, it's reached a point where they're very embarrassed about it, but they can't stop it. That's when you make that habit breaking appliance. It is permanently fixed and cemented onto your tooth until you break the habit. Then you can remove it, but it's not something that the child can remove every night by themselves. It is kind of uncomfortable, not gonna lie. It's literally wire behind your tooth. It's not sharp, it's not going to hurt you, but the moment you put it in, it's going to be like, boom, oh, I need to. It's almost like it becomes so habitual that the child is sleeping with their thumb in their mouth. But this little mesh appliance at the back of their teeth is going to constantly remind them. So usually after wearing it for a few months, we're pretty successful. Sometimes we keep it on longer, and once the child is confirmed that they've successfully broken that habit, that's when you can remove it.
Another question is, how will having deteriorated baby teeth, like having a lot of cavities and that severe decay that you showed us in those cases, will those have an impact on the incoming adult teeth?
So it can. There's actually a term called Turner's tooth. If a cavity is left untreated, or if there's trauma to the baby tooth, and if there's a massive infection, it can actually spread upwards in the bone that's holding the tooth. But that's where the permanent tooth is coming in as well, which is why we're constantly telling parents. But a lot of times they'll say, why? It's just a baby tooth. Why do you need to fix it? And it's like, we do have to, because if we leave it untreated, that infection is going to grow and it's going to affect the permanent tooth. And we've seen a lot of times where the permanent tooth that comes in has enamel defects. The shape is weird. It has a lot of extensive staining on it, which could be from an infection from the primary tooth or trauma to the primary tooth.
So when do you determine to use a crown on kids, because they have like the ingrowing adult teeth? When do you exactly decide at what age or anything that you should just take it out versus just putting a crown over it?
So it depends on the size of the cavity. A lot of the times, if it's small cavity, we can fix it with a filling material, which could be a white filling or a silver filling. If the cavity is quite large and the tooth is weak, that's when we want to give it 360-degree coverage. That's when we put a crown. And just like a regular tooth would get loose and fall off, similarly, the tooth continues to get loose, and when it falls off with the crown. So it's not going to affect the permanent tooth.
Would you say that crowns are sort of the most difficult procedures that you have to do on younger kids, or what procedure do you think is sort of the most difficult, that is very hard for the kids to handle?
I don't think so. Crowns are actually, in my opinion, now being on the other side, because I'm becoming a pediatric dentist pretty soon, they're much easier than fillings, actually. If you ask the dental student, they'd probably tell you that oh, the crown sounds so hard, but they're not. For a child as well, um, if the child is numb, if the anesthetic has worked, whether you do an extraction or a crown or a filling, they should not be able to feel anything. And that is the best behavior management tool. If your child is numb, has no idea what's going on in their mouth, to them it doesn't matter, as long as you're quick, you're working, fast, and they have a little bit of laughing gas, you're distracting them, no procedure should be hard for a child. Obviously, after an extraction is done, if they had an infection, the healing time once the anesthetic wears off can be a little longer. And I always tell the parent, give them Tylenol in the right dosage, which is age appropriate if required. If they have a swelling, we'll prescribe antibiotics to them. But if a child is numb, they should not be able to feel your treatment.
Do the treatments of fillings and crowns, do they typically take longer than it would if you were working on an adult, or do they take around the same amount of time?
They take a lot less time than adult teeth, in my opinion.
And because pediatric dentistry is sort of like a specialty, are the visits sort of more expensive than they would if compared to just visiting a general dentist for kids?
I don't think so. It's just that general dentists can see kids, but they'll see the really cooperative kids. When a child is even slightly, anxious, which happens a lot, the general dentist will usually refer them to see the specialist pediatric dentist. Also, we have tools if it's a very anxious child, if it's somebody with special needs. We sedate the child, or we put them to sleep completely along with an anesthesiologist and do the treatment under general anesthesia, which is not something that a general dentist would do. So price wise, I don't believe there's a big difference in prices for a pediatric dentist versus a general dentist for the treatment. It varies a lot from state to state and whether it's covered by insurance or not. So that plays a role, but I don't think that that makes a difference. It's just that you're seeing children all day, every day, and you're very well equipped to handle any difficult situations.
Do you know if the rest of your staff have to do sort of additional training to work with pediatric kids, like your dental assistant? Do they need any additional training at all, or do they just sort of need to do the general dental assisting programs and they are able to
dental assistants, they can do the dental assisting programs, and that should do it for them. For us, we have to do pediatric advanced life support, which is PALS. That I didn't have to do as a general dentist. That's an additional training that the residents have to do. But dental assisting, you can work with adults or with children, and you're trained to work with both.
So how did dental residents? If did you do residency when you were becoming a general dentist?
No, I did. So there is a general practice residency. I did not. I just did dental school. I got my DDS and practice as a general dentist, and then I only got back to residency recently.
So how does dental school sort of differ from pediatric residency? Is it just a difference of more of going into the clinic more, or like how does it differ? Is it more like not as lecture based or anything?
So dental school is a lot of didactics, a lot of preclinical, which is you're working on fake teeth and typodonts and extracted teeth. Then you start working on adults, but you're doing all sorts of general dentistry. You're doing regular fillings on adults. You're seeing children. You're seeing, patients who need cleanings. You're doing extractions. So you're doing all the branches of dentistry, but you're doing the more basic treatment. And if there's a case which is beyond your scope, that's when you're referring them to a specialist. Now, residency, it differs, program to program, but my residency is a very heavy clinical program, so you're pretty much working all day, every day. We do study on our own time. We have online lectures, but that's not we don't have like classroom lectures or anything like that. We're pretty much working in like a hospital-based setup sort of throughout the day.
And moving back to like the beginning of your presentation when you were talking about sort of like your dental school days, your practice days, like why did you want to sort of practice in so many different nations? Is it just like because you like traveling, or what kind of brought you to all those different places other than like I know you mentioned like Kenya, you wanted to go like the clinic, and Dubai you sort of want to move away because a lot of people were doing more restoration work. So what exactly is there like a prime motive?
It's just life that happened. When I was in India, I really wanted to further my education. My parents are also doctors, but they went to the UK to get their degree, and I did an exchange program at USC in 2009. And that's when I realized, oh, like, I really want to come to the United States. My brother lived in San Francisco, so I said, this is a good time for me to come and check it out over here. So that's how the United States happened. And then my husband and I decided to move to Dubai because our families were there. That's how Dubai happened. And then India, because I went to dental school for India initially. Kenya, I just wanted to go volunteer there. And then when I wanted to go back to residency, I knew that I've seen the kind of education that we have here in North America, and I wouldn't go to any other place to get it. So I came back to specialize to Philadelphia.
So when attending all these different schools in all these different nations, do you think it benefited sort of like the way you learn, or do you think it was like sort of a difficulty and like it caused a lot of challenges for you in learning?
Um, I wouldn't say challenges in learning. I think, if at all, it made me. I feel like every time you go to a new place or new country, you develop such an appreciation for people, culture, languages. And if at all, I feel like it's helped me in my profession. There is a lot of difficulty with licensing. So that would be the hard part, to get the license to practice as a dentist, a lot of exams. So that's not fun. But apart from that, I think it's only made me a better clinician to have been able to see struggles that people face in different countries, or just perspective of people is so different. In Kenya, like you're just doing a lot of extractions because they just want to get out of pain, and in Dubai, I barely did any extractions because everybody wanted to save their teeth. Here, we're doing a lot of preventative visits. I'm seeing a lot of kids, so it's just made me, you know, better equipped to help my patients.
So because you were in so many different places, was there ever instance of like a language barrier, or did you have like translators, or are you like sort of like fluent in all these different languages?
I am not. I wish I was. Definitely had a lot of language barriers. Luckily, English works pretty well in a lot of places. When I was in India, actually, in India, we have over 216 languages. So I speak 5 Indian languages, but none of them worked in the dental school that I went to. So we had a lot of our nurses translate for us. And sometimes a lot of them spoke, our national language, which is Hindi or English, so that helped. In Dubai, I would say a majority of people spoke English. Sometimes I had older patients who only spoke Arabic, and I would have to have somebody translate for me. In Kenya, the language with the Maasai population is Ma, and I only learned a few words, but I had dental assistants who were my backbone. In the United States, I am trying to learn Spanish. I'm not good at it. Again, I would say that would be a big help. It would be a great tool set to have to know Spanish, just to be in this profession at all, because there's a lot of people who speak only Spanish. We do have a translator box. It's almost like a portable machine which has every language. So we have a lot of Cantonese speaking patients, Portuguese. So anytime that we don't have a Spanish speaking person or a Spanish speaking doctor, we just literally press that button, and then we have a translator in the room who kind of helps to talk to our patients.
So do you recommend sort of all pre-dental and dental students to sort of do sort of the amount of traveling to different countries that you had experienced?
No, I don't think it's a requirement. I think if you can go volunteer in places, I think that is amazing. I think it'll help you in your profession and just in life. I think it helps you so much. I know there's a lot of dental volunteering that happens in like Guatemala and things like that. My dental school had organized some. So yeah, if you do get an opportunity, any kind of volunteering experience, I think it genuinely makes you a more caring person. You see what struggles people in different, developing countries are facing. It looks great on your applications. So I would highly recommend any kind of volunteering. It doesn't have to be outside the country. It can be within the country. when I was in San Francisco, I did something called Project Homeless Connect. When I was in Colorado, I did something called COMOM, which is Colorado Mission of Mercy. Right now in Philadelphia, there's something called Give Kids a Smile, which is GCAS. All of these things, just find what's happening in your city, go volunteer, get a sense of it, go volunteer at a dental practice as an assistant. Sometimes they won't even pay you. Just go shadow if you can. Obviously, with COVID, things were hard. If you can work as a dental assistant, that's great. If you can't, go shadow. Just get an idea of what you're technically getting into, because maybe it's for you, maybe it's not for you, but at least you'll have some idea before going in. So I think volunteering, shadowing is great. I know right now you guys are doing it virtually, but things are opening up. So start pestering some dentists in your areas and go do that, because it'll really help you.
And a question from the chat is, if the child had been older for the front teeth replacement, would your treatment plan have been the same, or would you have waited for the adult teeth to come in?
Our aim is to try and save teeth when we can. The child we had extracted the 4 teeth, the teeth were just so gross, like it was just such terrible decay that there was nothing left. It was all like mush. So we had to extract them because there was no way to save them. The other case that you saw with all the black stains, and then we got white craps, those teeth were savable. There was enough healthy tooth structure for us to remove the decay and then put a white cap on them. So only if the tooth is so loose that it's close to falling off, then we won't probably treat it. We'll leave it as it is or extract it. But if it is still going to be in the mouth for the next couple of months or years, or more like a couple of years, then we usually want to try and save it, because you don't want to take away the front teeth for a child. It affects their smile. So if you can help it, we always want to try and save them.
And how does the schooling to convert your international degree to American degrees look like? Like, do you guys sort of just do clinicals, or is it I guess, can you describe it?
So no, they actually convert a 4-year dental school into 2 years. So it's a lot of clinical and it's a lot of didactic. So it's definitely a pretty intensive, compressed program, because the requirements don't change. They just expect you to know more because you've already been through dental school. Which clinically, yes, but didactically, it's still a lot of studying and exam taking to do.
If you were to go to a different nation, so let's say like Canada, would you have to sort of go through the entire process of like conversion of degree, or is it just America that
Canada? They respect each other's degrees and you can work. I believe Singapore also accepts. I know, like for example, Dubai accepts a U.S. degree. I think New Zealand accepts a U.S. degree. Singapore accepts a U.S. degree, but not vice versa. The only degree that the United States accepts is Canada, and there's actually 1 or 2 schools in Mexico which are accepted in the state of California. So I think it's called La Salle Dental Program, which is in somewhere in Leon. So I have friends who went to dental school there, and they're practicing in California. But again, very few and far that you can practice after getting a degree from other countries, apart from Canada.
Does working in pediatrics include more of teaching and educating the parents about sort of like dental hygiene for their kids, or is it equal amounts if when you were working as a general dentist versus a pediatric?
I mean, it's a whole different world, and I would say the hardest part of my job is always the parents. It's a lot of I think kids are hilarious. Kids are so fun. They're like stand-up comedians. The stuff they say, it just cracks me up all the time. It's the parents. A lot of the times they're very receptive to our feedback. A lot of the times they can get a little, upset and frustrated. And, it's easy for me to say, hey, you need to, you can't put your child to bed with a bottle of milk or with a bottle of juice. For that parent, it's going to be sleepless nights. But you have to make that decision to see what's best for your child. So there's a lot of educating parents, and if you're able to get through, that's half the battle won already.
So what would you say is like your favorite procedure with kids?
I mean, it sounds difficult, but I love extractions. I love silver caps. I don't think I have a favorite procedure, but when they're older kids and they're getting braces and they have to get extractions of their permanent teeth to create space, I think those are really fun procedures to do. So Yeah, and if you get a child numb and when they don't even know that you took a tooth out, I think that makes me feel like so cool when they're like, "Oh my god, really? Is it out already?" And I'm like, "Yeah." So that's probably one of my favorite things to do.
Since you like extractions a lot, how come you sort of like what made you, I guess, go into pediatrics compared to like oral surgery?
I mean, oral surgery is a lot more than extractions. I don't think I'm cut out for like orofacial trauma and reconstructive surgery and all of that. But more than anything, I just love working on kids. I find it fun. I find it rewarding. I'm so much happier working on kids, which is why I decided to go back for peds.
I guess in dental school, did you have a job while going through dental school?
No, while I was in dental school, I just was a full time dental student, and I think I worked on campus at the dental school, um, like in the admin office, doing some paperwork once in a while, but mostly it was just dental school. It was pretty intense. It's hard to keep up with a job because the hours are long. There's a lot of studying. There's a lot of after hours lab work, so it's hard to have a job.
How many hours do you say you spent like dedicated to school, like studying in class and clinics per sort of like week during residency?
Oh, during residency. Um, I mean, I think we work like it's residency that way is I find it less taxing compared to dental school. I found dental school kind of harder, but residency is like I would say 40 to 45 hours a week of working. When we're working though, we we just work. It's not relaxing or anything. We're working really hard, and then sometimes we work weekends, like on Saturdays. Sometimes we're on call, which means we have to have a phone on us at all times. And if there is an emergency, if a child falls, the child's in pain, we can sometimes take the emergency over the phone. Sometimes we have to go in after hours to the clinic to do the treatment. Um, and the studying, we take quizzes every week, which is all online. A couple of quizzes every week, and then we have board exams once in the 2 year program, which is going to be for me next year in May. So I'll be studying a lot more probably by the end of this year.
So I know you took a gap year, I mean not gap year, but like you took some time to sort of work as general dentist and you did pediatrics. But from undergrad to dental school, did you take like a gap year?
No. Since I went to dental school directly from high school in India, I did not, but I did take a gap year between dental school in India and dental school here because I was studying to take my boards, passing all my exams, doing all my requirements. So there was a 1 year gap at that time. And at that time, I worked as a dental assistant in San Francisco, but it was more like a voluntary position. But it really helped me kind of understand as to how things work in a dental office in this country, for example. So that really benefited me, and I made some great contacts. I got recommendation letters from, some of these dentists that I shadowed. So it was a really great experience.
And last question before we end the stream. I guess what do you recommend for there to be any sort of educational changes? I know you said each nation sort of like they they care about more things than others in terms of like hygiene or like looks and everything. So how do you think it's best to sort of like educate worldwide sort of the importance of hygiene?
I mean, you want patients to come in not when they're in pain. When they're in pain, the treatment is usually much harder because getting them numb is harder. They're already afraid of the dentist, and then the treatment is a lot more extensive, like extractions and root canals, and that's associated with pain. If they come in for their regular dental checkups when they're not in pain, you're making sure that you're, getting rid of all the bacteria, cleaning them out, and preventing bigger cavities. So just about saying you need to come in every 6 months from the age of 1, bring your children in because it's, if you don't get cavities, they're going to have really great appointments throughout. And even if you get cavities, we can always fix them. But if they're only coming when they have a big swelling, it's just so much more challenging for the patient, for the parent, for the dentist. So, yeah, just about coming in as a regular, like how you do your annual physical exams, coming in twice a year to do your dental exams as well.
And one last question from the chat. Did you have any memorable emergency cases in the UAE?
I can't think of the bat on UAE, but just this Saturday, I had a pretty interesting case that we were on call, and this 10-year-old child was at at the pool with her sister, and they were going down a slide. Sister slipped and literally kicked her in the face, and basically the front tooth went completely boom inside. So it was like 10 p.m. at night. We went and opened up the clinic. We got her numb. We had to reposition the tooth, and then we put brackets on all of them and a wire to kind of splint it together. This kid was a complete champ. Like, she didn't flinch, which was great. But it was, it's always challenging when a child is pretty traumatized, and if you don't fix it right away, she can lose that tooth pretty quickly. So that's why it's a dental emergency. So that was just recently, less than a week ago. So that was probably one of my last memories of an emergency case.
All right, thank you so much, Dr. Kodak, and to everyone for tuning in for today's session. Just a reminder to take the quiz after this video, and thank you so much for watching.